Okay, the recording is on. I will just open the PowerPoint. Are you able to see my PowerPoint? Can someone unmute and tell me?
No, sir. Yes, sir. Yes, sir.
You're able to see? Okay, fine. Okay, so in today's practical class, we are going to learn about how to examine the reflexes. Okay, so I think in the theory part already we have learned a lot about reflexes. Okay, so what is a reflex? A reflex may be defined as an immediate or involuntary response to a stimulus. Some sudden stimulus, immediately you're going to see a response to it, which is totally involuntary. And the reflex depends on a reflex arc. I think all these things we have learned in the theory class, and I also told you reflex arc is an important question. I'm not going into the details of that. So somebody is waiting to join. So types of reflexes, you have the superficial reflexes and the deep reflexes. So both we will be learning today how to do. So the deep reflexes or the deep tendon reflexes, in that you have the jaw jerk, biceps jerk, triceps jerk, supinator or brachioradialis jerk, knee jerk and ankle jerk. All these things you will be doing. Okay, in the superficial reflexes, all these are superficial reflexes. You have the plantar reflex, cremasteric reflex, bulbocavernous reflex, but we are not doing everything. Mainly you'll be doing the plantar reflex. Plantar reflex you will be doing, and you will be also doing the conjunctival reflex and corneal reflex. Pupillary reflex is also a part of this, but it will be taught to you in your next practicals, which is on cranial nerves. Okay, in that you will be learning how to do the pupillary reflexes. So before examining, looking for any reflexes, we have to take certain precautions. So let's see what are the precautions. First is, subject should be very relaxed. If you see a subject were very tensed and trying to keep all the muscles tight, very anxious, and if you try to examine him, the reflexes may not come properly. So just assure the subject that this is a very safe procedure. Nothing is going to cause, it's not going to cause any kind of harm to them. So they have to just relax and listen to your instructions. So that's very important. So reassure the subject. That's what I was trying to tell you, that because you are going to elicit all these reflexes by using a hammer. Okay, not the hammer which is used in the building construction. Okay, what hammer we are going to use is called a knee hammer. I'll be showing you. Okay, so as soon as they see the hammer, they should not get scared that you're going to hit them. So tell them it's a very painless procedure. Ensure the muscle being tested is visible. That's a very important point. Now let's say you are trying to do a biceps jerk. I'll be showing how to do. In the biceps jerk, whenever you are trying to do a biceps jerk, you have to make sure that the biceps muscle is visible. Okay, because when you're trying to elicit this response, you will be seeing the biceps muscle is going to contract, very slight contraction you are going to notice. So to see that contraction, you should make sure that biceps muscle is, or any muscle, whichever you are trying to test, that muscle is visible for you. Okay, then we will be striking the tendon of the respective muscle, and we are not going to hit the muscle belly. Let's say, for example, same thing, if you are trying to check for the biceps jerk, we will be hitting the biceps tendon. We are not going to hit the muscle with the knee hammer. So once you hit the tendon of a particular muscle, the muscle is going to respond to your stimulus by contracting. So whenever you are trying to hit the tendon of the muscle will respond to you by a small contraction. So you have to look for that contraction. Okay, then you have to test the symmetry of the reflex on the opposite side. In the last class also I told you, even in the respiratory system also, whenever we are checking on one particular side, always you have to compare to the opposite side, then you have to go to the next area. Okay, same thing here also. When you are checking the biceps jerk on the right side, you should always check the biceps jerk on the left side, then you have to go to the next. Now because we will be doing a biceps jerk, we will do a triceps jerk also. So first you do biceps jerk on both sides, then you go to the triceps jerk. Okay, that is the meaning of that. If reflexes are not elicited, let's say for example you are trying to elicit the same biceps jerk, and suddenly whenever you are trying to elicit this reflex, you are not seeing any contraction in that particular muscle. That doesn't mean directly you write the biceps jerk is absent. Before writing the biceps jerk is absent, you should always do what is called this Gendraski's maneuver. Okay, after doing Gendraski's maneuver, even then if you are not able to elicit the reflex, then you should write the reflex is absent. Okay, I will tell you how to do that later. So this is the knee hammer. Okay, are you able to see? One of you unmute and tell me.
Yes, sir.
Okay,
Yes, sir.
so the knee hammer, there are different models in the knee hammer, but overall principle remains the same. Okay, in this you can see a triangular head. In some knee hammers you get a circular. Instead of being a triangle, it will be circular. Okay, whatever it is, the function is very much similar. Most of the places they use this the triangular headed one. In some places they use circular also. Okay, anything we can use. As a student, even in your college, we will be using your triangular shape only. Okay, so here you have a narrow end. This end is used only in some types of eliciting a reflex. For example, for biceps jerk, we use the narrow end. Okay, then we have the jaw jerk. That is also we use the narrow end. Where do we use broad end? Broad end is used when you are eliciting knee jerk. Okay, so like that, that's how we use this narrow end and broad end. This is the handle, and in some knee hammers, this is one particular model. In other model, in this area, you will have a detachable joint here. When you just unscrew it, you will be having a sharp end inside that is used for eliciting a plantar reflex. Okay, or we can use our key also, a bike key or a car key, that also we can use. Okay, so that's about this is the only instrument what we are going to use in today's practicals. Now let's learn one by one. We will start with the deep tendon reflexes. So in the deep tendon reflexes, these are the things what you're going to elicit. You have the jaw jerk, biceps jerk, triceps jerk, supinator jerk, knee jerk, and ankle jerk. Okay, you're going to make a table for this, and you're going to write your responses. The table is in the last part. I'll be anyhow sharing you the PowerPoint also. You can copy down the table and enter the readings in your record book directly. Okay, so for all these reflexes, we have to remember these values. What is this? C5, C6, C6, C7, C5, C6, L2, L3, L4. These are the root values of these reflexes. Means for the biceps jerk, the nerve supply is coming from the cranial segment of the spinal cord number 5 and number 6. Okay, if you go back to your anatomy class, and you would have learned that the spinal segments are divided. You have the cranial segments named as C. You have thoracic segments named as T. You have lumbar segments named as L. You have sacral segments named as S. Okay, and in every segment you have these subdivisions. So biceps jerk, it is getting its nerve supply from C5, C6. Supinator jerk, same thing, C5, C6. These values you have to mug it up. Okay, triceps jerk, nerve supply from C6 and C7. Next you have the knee jerk, L2, L3, L4. Ankle jerk, S1 and S2. Jaw jerk is getting its nerve supply from a cranial nerve. Which cranial nerve? Fifth cranial nerve. Okay, all these are getting from the spinal nerves. Okay, but this is you're getting a supply from cranial nerve. Okay. So for eliciting biceps jerk, okay, what you have to do is make the patient sit comfortably on a chair. Okay, watch the diagram very closely. Wait, I'll just put on the laser point. Are you able to see the laser point? Can someone unmute?
Yes, sir.
Okay, fine.
Yes,
yeah. So see, so this is the examiner's hand, and this is the patient's hand. Okay. So for eliciting the biceps jerk, you can see patient's hand is placed in an angle like this, 90 degree, at the elbow joint. Okay, you can see the patient's hand has to be comfortably resting on the examiner's hand. Okay, if the patient's hand is not supported like this, you are not going to get the reflex. Okay, you should support the patient's hand very comfortably like this. The patient's hand entire weight, it should be on your hand. Okay, then you can see the doctor is placing the thumb finger in the elbow joint here. Okay, now I want all of you, what you have to do is 1 second. Okay, I think you can see my video now. I want all of you just take one index finger. Okay, just try to touch your elbow joint. Okay, just keep your hand in the elbow joint and just try to flex the hand. Just tell me what is happening now when you do that. One of you can unmute and tell me. Can you see that when you place your hand, when you're trying to flex, you can see some structure is becoming very prominent. Something is becoming very tight. Something you can feel that something is becoming very prominent. Are you able to feel that? Hello?
Yes, the biceps tendon.
Yeah, very good. So whatever you are feeling, that is called the biceps tendon. Okay. Now what you have to do is, see, your thumb finger should be placed on the biceps tendon. Thumb finger should be placed on the biceps tendon. With your opposite hand, you have to take the knee hammer and see, one more thing what I told you. Whenever you are trying to elicit a particular reflex, you have to expose that muscle. What is this reflex? Biceps jerk. So you have to expose the biceps. You have to lift the shirt up here and you have to see the muscle. With your opposite hand, okay, use the narrow end to strike. So you have the broad end here and you have the narrow end here. Okay, you can see in this view also. You have to just lift the hammer and you have to tap on your thumb. Don't tap the biceps tendon. Okay, I repeat, on the biceps tendon you are placing your thumb. Okay, and on your thumb you are taking the knee hammer and you are hitting your thumb, which is placed on the biceps tendon. Whenever you do that, okay, the movement should happen at the wrist joint. Very freely you have to just hit like this, just free movement. Okay, the knee hammer will be moving like an arc. Okay, don't try to hit like this. It should be movement should be a free movement like this. Okay, when you try to hit that, you are going to see the biceps muscle is going to contract. Okay, you know what is happening here, what is the mechanism behind this. Whenever in the theory class, also in your reflexes class, we have told you, okay, whenever you stretch a muscle, the muscle is going to contract back. Same thing is happening here. What we are trying to do is, when we are trying to hit the biceps tendon, okay, we are trying to stretch the muscle. The muscle is going to respond by immediately contracting back to its original place. That is the reason you see a reflex here. Okay, so I repeat again, the examiner's hand is placed like this on the doctor's hand. So this is the patient's hand, the doctor's hand, very comfortably resting. Okay, with the same hand you can see the doctor has flexed the hand like this and kept only the thumb on the biceps tendon. With the opposite hand, she is holding the knee hammer. The narrow end of the knee hammer is going to hit the thumb and you are going to see the response. This is biceps jerk. Okay, this is biceps jerk. I will be showing a video. I will show the video in the last. I will just show all the pictures right now. The reason to show the video in the last is because if I just play the video, I don't know whether any copyright issues are there. Okay, for that reason I will play the video in the last, so that our this recording will not get disturbed. Next is the triceps jerk. Okay, for triceps jerk, what you have to do is, you have to go behind the patient. Go behind the patient, and so just imagine the patient's hand will be normally just like this in the side of his body. You have to lift the patient's hand like this. Okay, so doctor is standing behind patient's hand. Okay, and again you can see the doctor is supporting the patient's hand here. Again you are getting a 90-degree angle like this. Okay, this is the one more angle. Okay, here you can see the doctor is standing in the front of the patient. You can do either way. You can stand behind or you can stand in the front. Only make sure that the patient's hand is going to rest on your hand. Okay, take the hammer, take the knee hammer. Now you notice here, you are hitting with the broad end. You are not using narrow end, and you are hitting the muscle directly, the tendon, not the muscle. You are hitting the tendon directly here. Okay. So take the broad end of the knee hammer, just lift it up. Where are you going to hit now? Is the next question. You have such a big area here. Where are you going to hit it? So this is your olecranon process. Okay, just above the olecranon, you have to hit like this. Whenever you hit that way, what is going to happen is the muscle which is like this, it is going you can also see they have exposed the muscle, the triceps muscle here. Okay, whenever you hit, this muscle is going to contract. When the triceps muscle contracts, what you're going to see is this entire the hand which is like this hand is going to move this way. Follow the laser point. Okay, the hand which is like this, it is going to extend this way. It is going to, so your hand is like this, it's going to extend this way. So this is the triceps jerk. Triceps jerk. Is it clear? Any queries till now? Can somebody unmute and tell me?
No, sir.
Okay. You can do triceps jerk this way also. So there are two ways of doing it. One is you go stand behind the patient or stand in front of the patient. Okay, lift his hand and hit on the above the olecranon process using your broad end of the knee hammer. This is one way. Or you can place the hand like this way also. Okay, just take the hand again 90 degrees and keep the hand in the front of the patient's body like this way. Okay, again you can see the doctor is supporting the patient's hand with her opposite hand. She is hitting above the olecranon process. Okay, I think she is hitting a little very high. Don't hit so much high. I think somewhere this region. In this region, if you hit, you are going to see a contraction. Okay, you should always expose the muscle nicely. Whatever they have exposed here not sufficient, expose a little more. So the root value of triceps jerk C6 and C7. Next jerk is supinator jerk. So what is the position of the hand? It is like giving a handshake. Okay, just hold like just giving a shake hand to a person. Okay, just in that position, keep the patient's hand. Support again. See, in everything you are going to support the patient's hand. Okay, because if you don't support the hand, what will happen is if you ask the patient to keep his hand like this, the triceps is contracting here. When a muscle is contracting, when you try to hit the reflex, you're not going to get the reflex. The hand has to be fully loose. Entire patient's hand weight should be on your hand. Then only you will see the muscle contraction, or you are not going to see a muscle contraction. So only should you support the patient hand properly. So you can see she is just supporting the patient's hand here. Okay, with the opposite hand here she is using a narrow end. Okay, as a student, what I feel is you can use a broad end here. Here also you can use broad end. Everywhere we are going to use broad end except two places. That is for your jaw jerk, which I am going to show you later, and your biceps jerk. For biceps jerk we use a narrow end. For jaw jerk we are going to use a narrow end. Remember like that. For everything it is going to be the broad end. Okay. So here where you are going to hit. Now, so this is your thumb here. As you go back, you can feel one small projection here. You can try to palpate and see. From your thumb, just slightly move your hand behind. You'll be seeing a small projection. You can feel a small projection. That is the radius styloid process. Okay, just little towards your body, from the styloid process. Just move a little bit and hit there. Okay, whenever you hit there, again you are going to see the that's how you do a supinator jerk. Okay, I'll show you a video. You will be understanding all these things very clearly in the last. Next is the knee jerk. Knee jerk. For knee jerk also you have a couple of ways of doing it. Okay, Here you can see the patient is crossing one leg over the other. I really don't recommend this way. You can do this way also. The best way is make the patient to sit on a table like this, so that his leg is freely, it's not touching the ground. Leg should not touch the ground. The leg is freely loosely hanging. Patient is sitting on the couch or the table. Okay, take the knee hammer and you hit on the ligamentum patella. So here what happens, so the knee joint, so your patella is present here. Okay, so your thigh region, you have the knee joint in the front. Patella, very small bone. Just palpate the patella and go little forward. You will be feeling a small patella is a bone, so it will be very hard. Okay, as you go a little forward, you can feel something soft. Can you please feel and see yourself? Okay, just try to feel your knee joint. Okay, you'll be seeing a hard structure. From the hard structure, try to go a little down, palpating down further. You'll be seeing a small area where compared to the bone it is little more softer. Don't expect some sponge is kept over there. Compared to your bone, the patella, you'll be feeling something very slightly softer. That is your the tendon of your the quadriceps femoris, which comes down and which attaches to the tibial tuberosity. Okay, so there you have to hit that tendon. When you hit over there, you will see the muscle is going to contract and you will see the extension of the leg at the knee joint. Okay, so that is how you do a knee jerk. I will show you the video. Now if a patient is able to sit, you can do this way. What if the patient is bedridden, he is in the ICU, you cannot talk to the patient. In such case, the patient is lying down like this. Just lift the patient's leg from the couch. See what is doing, he is supporting the muscle now. He is supporting the muscle now. Okay, with the opposite hand is going to hit here, and he is exposed the muscle and he can see the contraction of the muscle. This is another way of doing the knee jerk. Next is the ankle jerk. What is the root value of knee jerk? L2, L3, L4. L2, L3, L4. Next is ankle jerk. How do you do ankle jerk? You can see the patient lying down. He is placing one leg above the another leg, slightly flexed like this, and here you are having your Achilles tendon. Okay, with one hand you can see the doctor is dorsiflexing. So in your ankle you have two motions now. Dorsiflexion means flexing the leg this way. This is the dorsum. Okay, dorsum of the feet. So this is the dorsum of the feet. Below that is the plantar surface of the feet. So whenever you flex towards this way, this is the dorsiflexion. Whenever you flex downwards, it's a plantar flexion. Okay, so you with one hand dorsiflex, with the opposite hand again you are using broad end of the knee hammer and you are going to hit on the Achilles tendon. Whenever you hit, you are going to see the muscle here is going to contract, the calf muscles. You will see a contraction here, and also you will be seeing, if you had dorsiflexed it, whenever you hit, the person is going to respond by plantar flexion. So the leg which was this way is going to move towards this way, plantar flexion. Okay, so what is the root value of ankle jerk? S1 and S2. S1 and S2. And there's one more way of doing this. You can keep it this way also. Instead of placing it on the opposite leg, you can just place it on the bed also, slightly flex it. Okay, you can do one more way also. If the patient when sitting, you can ask the patient to stand, place his leg on a chair like this. Okay, and take the knee hammer and hit on the Achilles tendon. Is this correct? Is there anything wrong in this image? What is missing?
Shall we throw?
We didn't support her.
Here supporting is not needed, but what is missing is the doctor has not dorsiflexed. With one hand, she was supposed to dorsiflex the feet. That she has not done. That's the one mistake here. Okay, so she has to sit down, dorsiflex with one hand. With one more hand, she has to hit on the Achilles tendon and look for the muscle contraction. Okay, so that is the ankle jerk. So this is one nice way of remembering these these number root values. Okay, you start from ankle jerk. What is the root value of ankle jerk? 1, 2. Come one above. What is next? Knee jerk. What is the root value? 3, 4. Okay, then come to supinator, your hand, supinator jerk. What is the value? 5, 6. Next you have what? Triceps. 6, 7. Like so, it's in order 1, 2, 3, 4, 5, 6. Instead of 7, 8, it is 6, 7. Okay, this is one way also you can try to just remember. But don't forget that the segments are different. Only the numbers are you can remember like that. Because this is sacral segment, this is lumbar segment. Okay, that you have to be careful. So that is about the deep tendon reflexes. Okay. Next is the superficial reflex. In the superficial reflexes, you have the corneal and conjunctival reflex. So here what we will do is we take a cotton, make a small wisp, take a wisp of cotton, just take a cotton, just make it sharp in one end, cotton, and what you have to do is you should ask the patient to see forward. From the side, without the patient's knowledge, you have to just come and touch the conjunctiva. Whenever you touch the conjunctiva, you will be conjunctiva means you will be touching the white portion of the eye, the white portion. Whenever you touch that, you will be seeing the patient will blink the eyes. That is the reflex. That is the conjunctival reflex. Corneal reflex, same thing. Take the wisp of cotton and touch the limbus. What is the limbus is? You have your the white portion, and you may have, of course, your black eye or a brown eye or a gray eye, whatever. Okay, so the junction between your the black or the dark portion and the white portion. Okay, there the junction is called the limbus of the cornea. You have to touch there. When you touch there with wisp of cotton, same thing you are going to see that the patient will close his eye, blink his eye. That is the corneal reflex. Conjunctival reflex you can do, but don't do corneal reflex. Okay, because we don't know that wisp of cotton may have it would have fallen somewhere, not kept in a proper hygiene place, and when you touch the cornea, there's always a chances of getting corneal infections, which is not really good. Conjunctiva generally no problem, but corneal infections is not good. Okay, so that's how we do a corneal and conjunctival reflex, and you can see that is supplied by cranial nerves. So this they will be teaching you once again when they will be taking your practicals on cranial nerves. Okay, here mainly we are going to learn only two things here. One is the plantar reflex and abdominal reflex. I will be showing you. Okay, so the plantar reflex root value is L5S1. L5S1. This we should remember. Then you have the abdominal reflex. Root value T now. T is what? Thoracic. T7 to T12. Abdominal reflex. I will just show you that. So this is the plantar reflex. How you are going to do is you can take a key, bike key or a car key, or you can use your knee hammer's sharp end. Generally the knee hammer is having a very sharp end, and when you use that what will happen is you get a mark on the patient's feet. So better to take a blunt object. So a key is a very good thing. Take the key, and what you have to do is, so this is the patient's feet, what you are seeing, the plantar surface. Okay, you from this area take the key, and so this is the little toe, this is the, wait, I'll switch on the laser point. Yeah, so this is the little toe, this is your great toe. So towards the side of the little toe, take the key, just start like this in the end. Okay, and once you reach almost just below the fingers, come here and turn this way. So it's a reverse L. Okay, take the key, just and you should not do very slowly also, not very fast also, medium speed, just elicit like this. Okay, whenever you do that, what response you are going to see is this, you are going to see a response like this. So patient is going to plantar flex his fingers this way. Okay, what you see here is abnormal. Here there is dorsiflexion here. Dorsiflexion, he is flexing the finger towards the dorsum of the feet. This is abnormal. This is what is called the Babinski sign. I think in the theory class we had told you that regarding the Babinski sign. So now what is the normal response? There is plantar flexion of the great toe with the flexion of other toes. Okay. Somebody is coming and now enjoying. Who is that? Halima Sana. Okay, anyhow, I'll just allow them in the interest that you are going to learn. Abnormal response is what? Babinski's response. So here there is going to be extensor plantar response. Okay, that means your feet is going to dorsiflex, and there is going to be fanning of the toes. I will show you the video. Okay, there is going to be dorsiflexion, and all the toes, instead of adducting in the normal response, is going to abducting, and it's going to fan like this. Okay, so this is a very important sign which you see in upper motor neuron lesions. Babinski's sign. See here, whenever you are trying to elicit the reflex, you can see there is dorsiflexion followed by abduction and fanning. All the fingers are opening up like that, fanning of the toes. This is a abnormal response. Abdominal reflex, that is the last reflex for today's class. So here what happens, a light stimulus is passed across the abdominal skin in the plane of the dermatome from outer aspect towards the midline, and you are going to see the contraction of the abdominal muscle. Same thing, you can take the same blunt instrument, keys. Okay, so over the abdomen from the outside, you have to just very gently just give a stroke like that, very gentle stroke, outside to inside, outside to inside, outside to inside, outside to inside. Whenever you do this, you will see your abdominal muscle is going to contract. Okay, that is going to be your abdominal reflex. So the last thing is the report. Okay, this is what you have to write in your record. Examination of the reflexes. Write the personal data of the patient, and this is the table you have to make, 3 columns. So first you will do deep reflexes followed by the superficial reflexes. Okay, so biceps jerk. Here they are given the procedure. If you want, you can just remember it. Okay, mainly write the name of the reflex, write the observation, and write the inference. Okay, if you don't write the procedure also, doesn't really matter. Okay, write the name, observation, and what is your finding. So in biceps jerk, what did you see? You saw the contraction of the biceps muscle by seeing a small flexion at the elbow joint. What does it mean? That root C5 and C6 is normal, intact. Same thing for everything. Triceps jerk, your observation, your report. supinator jerk observation report, knee jerk observation report, ankle jerk observation report. So that is the deep reflexes, deep tendon reflexes. Superficial reflexes, only two we are doing, plantar reflex and abdominal reflex. So in plantar reflex, you saw the plantar flexion of the great toe with flexion of all the other toes. Same plantar flexion only, root value, it's normal. Abdominal reflex, you will see the contraction of the muscle, the abdominal muscle, and that is intact. Final report, reflex of so and so person, write the person's name on whom you have done the examination, is found to be normal. Okay, that is your final report slide. Okay, so now let's go to the video. I'll play the video.